So now we're going to see leg and the ankle joint. Okay. So now we're going to discuss the leg and the ankle joint. So first we start the leg. For leg, we have to know some basic points about the sciatic nerve. See, sciatic nerve root value. We know already sciatic nerve is having two components, tibial component and the common peroneal component. So sciatic nerve is divided into tibial component and the common peroneal component. Now the tibial part of sciatic nerve root value is ventral division of L4, L5, S1, S2, S3. And the common peroneal part root value is dorsal division of L4, L5, S1, S2. Yes. Now the sciatic nerve is having two components, and tibial part and the common peroneal part. Now the sciatic nerve, which is dividing at the upper angle of popliteal fossa. At the upper angle of popliteal fossa. At the upper angle of popliteal fossa into tibial nerve and the common peroneal nerve. So now tibial nerve and the common peroneal nerve are the branches of sciatic nerve arising at the level of upper angle of popliteal fossa. Clear? Right. Now this common peroneal nerve, see here, which wind around the neck of fibula. And divide into deep peroneal nerve and superficial peroneal nerve. Deep peroneal nerve, which is also known as deep fibular nerve. Superficial peroneal nerve, also known as superficial fibular nerve. So now we got three nerves: tibial nerve, deep peroneal nerve, and superficial peroneal nerve. So in the leg, we have three compartments. So that is what we're going to write. So in the leg, we have three compartments: posterior compartment of leg, anterior compartment of leg, and lateral compartment of leg. Each compartment is having their own nerve supply. Now the posterior compartment of leg, the nerve is tibial nerve. So tibial nerve, it is a nerve of posterior compartment of leg. Now anterior compartment of leg, the nerve is deep peroneal nerve. And for lateral compartment of leg, the nerve is superficial peroneal nerve. So we have three compartments of leg: posterior compartment of leg, tibial nerve; anterior compartment of leg, deep peroneal nerve; and lateral compartment of leg, superficial peroneal nerve. So each compartment is having their own nerve supply. Please remember, there is no overlapping, there is no exception. All the muscles in the posterior compartment of leg, it is supplied only by tibial nerve. All the muscles in the anterior compartment of leg, it is supplied only by deep peroneal nerve. All the muscles in the lateral compartment of leg, it is supplied only by superficial peroneal nerve. I told you, there is no overlapping, there is no exception. Okay? Right. Next, arteries. Again, each compartment is having their own artery supply. Again, there is no exception, there is no overlapping. All the muscles in the posterior compartment of leg, it is supplied only by posterior tibial artery. All the muscles in the anterior compartment of leg, it is supplied only by anterior tibial artery. Anterior tibial artery and posterior tibial artery are the terminal branches of popliteal artery. Very good. Now for lateral compartment of leg, artery is peroneal artery. And the peroneal artery is a branch of posterior tibial artery. Peroneal artery is a branch of posterior tibial artery. So these are the arteries and nerves for each compartment. Okay. Now from this itself, you can get a question. Which of the following is not supplied by tibial nerve? Which of the following is not supplied by anterior tibial artery? Which of the following is supplied by peroneal artery? Likewise, you may get the question. Now we see the compartments. First, we're going to start the posterior compartment of leg. Now in the posterior compartment of leg, we have two layers: superficial layer and a deep layer. Okay. Now the superficial layer, we have only muscles. Only three muscles are present. Now the neurovascular structures are present in the deep layer only. In the deep layer, we have four muscles plus neurovascular structures. So the superficial muscles get the nerve supply from the deep layer only. So the neurovascular structures are absent in superficial posterior compartment of leg? That is a question we got in 2018 AIMS exam question. 2018 AIMS exam, we got this question. The neurovascular structures are absent in, not present in, superficial posterior compartment of leg. We have only 3 muscles. Okay, which 3 muscles? See here, we have gastrocnemius muscle, plantaris muscle, and soleus muscle. Mnemonic is GPS muscle, very old mnemonic. G for gastrocnemius, P for plantaris, and S for soleus. Right. Now, in these 3 muscles, please underline plantaris muscle. Plantaris muscle, it is a vestigial muscle. The muscle is having very small belly and long tendon. So, plantaris muscle is having a very small belly plus the long tendon. So, it is not useful to do any action. That is why I am saying plantaris muscle, it is a vestigial muscle. But this plantaris tendon, I told you, no, we have a very long tendon. This long tendon of plantaris, it is useful for tendon augmentation and tendon repair procedures. So, plantaris tendon is using for tendon augmentation procedures and tendon repair procedures. So, whenever there is the shortening of the tendon, whenever there is a tendon rupture, the surgeon harvests the plantaris tendon and using for tendon repair and tendon augmentation procedures. That is the only advantage of this tendon. Okay, action wise, no. So now we have gastrocnemius and the soleus muscle. Now I told you we have 2 heads of gastrocnemius muscle. We have 2 heads of gastrocnemius. 2 heads of gastrocnemius. Now medial head and the lateral head. Okay, this is the medial head of gastrocnemius and lateral head of gastrocnemius. Please remember some basic points about the origin. The 2 gastrocnemius, they take origin from the condyles of femur. They take origin from the condyles of the femur, lateral condyle and the medial condyle. So what is the point? Why we have to know this? Now, this muscle takes origin from the condyles of the femur and crossing the knee joint on back side. So gastrocnemius muscle cross the knee joint posteriorly. I told you, any muscle crossing the knee in front, what they do? Extension of knee. Now this muscle is crossing the knee joint on the back side. What they do? Flexion. Very good. Please remember, gastrocnemius muscle, it is a weak flexor of a knee. Not a main muscle, it is a weak flexor of a knee. Okay? Right. Now one more point again, nowadays they are not asking this question. For the completion sake, I am saying, in the lateral head of gastrocnemius, one sesamoid bone is formed. The sesamoid bone is called fibula. Old question. Nowadays they are not asking this. For the completion sake, I am saying, fibula is a sesamoid bone. It is the sesamoid bone which is formed in the tendon of lateral head of gastrocnemius. Clear? Right. So now we have 2 heads of gastrocnemius and soleus. So now we have 3 heads. Now these 3 heads present in which area? In the leg. Now in the leg, we use one term, sural, which means leg. So now we have 3 heads which are present in leg. Now this is called triceps surae muscle. Triceps surae. Okay. So triceps surae, which contains the 2 heads of gastrocnemius and one soleus muscle. They form triceps surae. Okay. So triceps surae is formed by 2 heads of gastrocnemius and one soleus muscle. Now these 3 muscles, triceps surae, they form one common tendon. The tendon is attaching to which bone? Calcaneum bone. So this tendon is called calcaneal tendon or tendocalcaneus or Achilles tendon. Same meaning. Tendocalcaneus, tendon attaching to calcaneum bone, calcaneal tendon or Achilles tendon. Clear? Now what is the action of tendocalcaneus at the level of ankle joint? Now this tendocalcaneus crossing the ankle joint on the back side. Please remember, any muscle crossing the ankle joint on the back side. Now for example, this is my ankle joint. Okay. Now tendon crossing the ankle joint on the back side, pull the ankle joint towards the plantar side. So the foot is bending towards the sole, towards the plantar region. So any muscle crossing the ankle joint on the back side, what they do? Plantar flexion of the ankle joint. Plantar flexion of the ankle joint. So tendocalcaneus do plantar flexion of the ankle joint. Any muscle crossing the joint on the back side, plantar flexion of ankle. Any muscle crossing the joint in the front side, dorsiflexion of ankle. Clear? Right. Next one. That's all about the superficial layer. Next, a deep layer. Now, in the deep layer, we have 4 muscles. What are those? Your popliteus muscle, okay, and then tibialis posterior, flexor digitorum longus, and flexor hallucis longus. Now, see the popliteus muscle. Popliteus muscle, the origin is intracapsular. In the body, we have only 2 muscles having intracapsular origin. What are those? One is tendon of popliteus, another one is long head of biceps. So, long head of biceps and popliteus tendon, they have intracapsular origin. This is very important. This is intracapsular origin. Please don't forget. Now, origin, they won't ask you. Again, for the completion sake, I have given origin from the lateral surface of lateral condyle of the femur, and also takes origin from lateral meniscus and the popliteal ligament, and insertion to the posterior surface of tibia above the soleal line. Again, just remember this one point. The popliteus muscle is having intracapsular origin, and this muscle is crossing the knee joint on the back side. So, what is the action of popliteus muscle? I told you in the knee joint itself. The popliteus muscle, it is crossing the knee joint on the back side. So, what it will do? It flexes the knee. Very good. Again, I told you, it is the muscle which unlocks the knee. Yes, it is the muscle which unlocks the knee. And one more action is there. This muscle attached to lateral meniscus. So, this muscle also pull and save the lateral meniscus during knee injury. Lateral meniscus during knee injury. Okay. So, 3 actions are there for popliteus. It unlocks the knee, it flexes the knee, and it pulls the lateral meniscus. Okay. Right. If you remember this, that is more than sufficient. Now, what are the other muscles we have? Now, other muscles are, now we removed the superficial muscles. Okay. And this is the soleus muscle we have removed. And above the soleal line, yes, I told you this muscle is popliteus muscle. Okay, popliteus muscle. Fine. So, in the deep layer, below the popliteus muscle, we have 3 muscles. This is number 1, this is number 2, and this is number 3. We have 3 muscles. Now, this is medial side and this is lateral side. Medial and lateral. Okay. Now, the muscle which I marked as number 1, that muscle is a middlemost muscle. Now, you may think that the middlemost muscle should go to great toe. So, that muscle is flexor hallucis longus. No, it is not flexor hallucis longus. Now, that muscle is, see here, that muscle, it is coming like this, and which is dividing into 4 tendons. Can you see that? So, it is going to lateral 4 toes. That is digitorum. So, first muscle is our flexor digitorum longus. Flexor digitorum longus. And see the third muscle. Now, third muscle which is coming more from the lateral side, okay, and it is passing below the retinaculum band and which is going like this, going to the great toe. So, that means number 3 is our flexor hallucis longus. Flexor hallucis longus. And number 2 is tibialis posterior. Tibialis posterior. So, see the arrangement in leg. See, in the sole, easily you can identify. The tendon going to the great toe will be flexor hallucis longus. Tendon going to the lateral 4 toes will be the flexor digitorum longus. That is very easy to identify. But in the leg, in the posterior compartment of leg, you identify these muscles. The medialmost muscle in the posterior compartment of leg is flexor digitorum longus. The lateralmost muscle, flexor hallucis longus. In between these two, tibialis posterior. Very important. Okay. Now, what is the action of these 3 muscles? See, attachment of flexor digitorum longus, flexor hallucis longus, I told you, it go to great toe and lateral 4 toes. Now, they go to sole. Now, which layer of sole? Now, these 2 tendons present in the second layer of sole. In the second layer of sole. Okay. Now, what about tibialis posterior? See, tibialis posterior attachment, tibialis anterior, peroneus longus, peroneus brevis attachment. I'll have one diagram. I will show you attachment of these 4 tendons in the last. Okay, don't worry. So now the point is, you know the nerve supply. Now we have to write actions for these muscles. Insertion for tibialis posterior, tell you later, don't worry. Now what are the actions of these muscles? I told you these muscles, they cross the ankle joint on the back side. So what they do? All the muscles, they do plantar flexion of ankle. They do plantar flexion of ankle joint. They have a common action. Plantar flexion of ankle joint. Okay? Right. Now what about tibialis posterior? Now tibialis posterior, they have one additional movement. Now tibialis posterior present on the medial side. So tendons on the medial side helping for inversion movement. Tendons on the medial side, they pull the medial arch and increase the concavity and maintain the medial longitudinal arch. So tibialis posterior, please write, it is a muscle for inversion. And please remember, it is the main muscle for inversion. And this muscle also maintains medial longitudinal arch. Medial longitudinal arch. So three actions are there for tibialis posterior. What are those? Plantar flexion of ankle joint, inversion, and it maintains the medial longitudinal arch. Now flexor digitorum longus, flexor hallucis longus. Now flexor digitorum longus flex the lateral foretoes. Flexor hallucis longus flex the great toe. Okay, right. Those are the actions you have to remember for these muscles. Okay, and can you see the band here? Now that band is our flexor retinaculum band. So how the tendons are passing below this band? That is what we're going to see now. Now this is a flexor retinaculum band. Okay, now the tendons are passing in the order from medial to lateral. Again, this is very important. So in the INSET exam, I told you, you get sequential arrangement pattern questions. So again, it's a favorite topic for the AIMS exam, that is INSET exam. So arrange the structures sequentially while passing below the flexor retinaculum of the leg from medial to lateral. Now, first, we have to know the attachment of flexor retinaculum. The flexor retinaculum starting from medial malleolus and it is going to medial tubercle of the calcaneum bone. Starting from medial malleolus of tibia and to the medial tubercle of the calcaneum bone. The attachment of flexor retinaculum. Now, how the tendons are passing? We have mnemonic. Mnemonic is Tom, Dumbledore, and Harry. Okay, so Tom, Dumbledore, and Harry. So Tom, Dumbledore, and Harry is a mnemonic to remember the structures passing below the flexor retinaculum of the leg. Tom, Dumbledore, and Harry. Tom means, I think you know, Tom Marlborough Riddle, nothing but Lord Voldemort. So yes, we are using the Harry Potter characters to write, to know the mnemonic of structures passing below the flexor retinaculum. So Tom Marlborough Riddle, Voldemort, Dumbledore, and Harry Potter. So we are using the Harry Potter characters to remember the structures passing below the flexor retinaculum. So T is tibialis posterior. The medialmost structure is tibialis posterior. D, Dumbledore, flexor digitorum longus. And then lateralmost is the flexor hallucis longus. So Tom, Dumbledore, and Harry. So A is the artery. Which artery? Posterior tibial artery. N, nerve. Which nerve? Tibial nerve. So structures passing below the flexor retinaculum of the leg. The sequence medial to lateral. Tibialis posterior, flexor digitorum longus, posterior tibial artery, tibial nerve, and flexor hallucis longus. So this is how they are arranged. So what is a nerve which is passing below the flexor retinaculum of the leg? Tibial nerve. Similarly, in the upper limb, we have one nerve which is passing below the flexor retinaculum of the hand. Median nerve. Median nerve compression while passing below the flexor retinaculum of the hand. Carpal tunnel syndrome. Similarly, the compression of tibial nerve while passing below the flexor retinaculum of the leg. That is called tarsal tunnel syndrome. Very good. That is tarsal tunnel syndrome. So tarsal tunnel syndrome is nothing but compression of tibial nerve. Compression of tibial nerve. Compression of tibial nerve while passing below the flexor retinaculum of the leg. While passing below the flexor retinaculum of the leg. Okay? Yes. So now this tibial nerve enter the sole and enter into medial plantar nerve and lateral plantar nerve. Now we're going to start the anterior compartment of leg. So now in the anterior compartment of leg, we have 4 muscles. Tibialis anterior, extensor digitorum longus, extensor hallucis longus, and peroneus tertius. We have 4 muscles. So we know already all the muscles in the anterior compartment of leg, it is supplied by, yes, deep peroneal nerve, artery, anterior tibial artery. Fine. Now, the 3 muscles, tibialis anterior, extensor digitorum longus, and extensor hallucis longus. Now, these 3 muscles, they cross the ankle joint in the front side. See, any muscle cross the ankle joint on the back side, I told you they do plantar flexion. Now, this is ankle joint. Okay. Now, muscles crossing the ankle joint in the front side, what they do? They bend the ankle in the dorsum side. This is called dorsiflexion. So, the 3 muscles, the tibialis anterior, extensor digitorum longus, extensor hallucis longus, they do dorsiflexion of the ankle joint. They do dorsiflexion of ankle joint. Next, tibialis anterior. See, tibialis anterior, I told you along with the tibialis posterior, they present on the medial side, they're helping for one specific movement called inversion. Plus, tibialis anterior, again present on the medial side, in the arches we will discuss, they are also helping for the maintenance of the medial longitudinal arch. Okay, right. Now what about extensor digitorum longus, extensor hallucis longus? Now extensor digitorum longus, extensor hallucis longus, again name itself you have a clue. Digiti means singular, digitorum plural form. So digitorum means it goes to lateral 4 toes. It extends the lateral 4 toes. Extensor digitorum longus extend the lateral 4 toes. Okay. Extensor hallucis longus extend the great toe. Extend the great toe. Now peroneus tertius. One more muscle we have. Now peroneus tertius muscle, it is a helping muscle or assisting muscle for eversion. It is not a main muscle. Eversion is done by peroneus longus and peroneus brevis. Peroneus tertius, it is not a main muscle. It is a helping muscle for peroneus longus and brevis for eversion. So it is the assisting muscle for eversion. Helping muscle for peroneus longus and brevis for eversion. Now the point is, peroneus tertius, it is a muscle in the anterior compartment of leg, supplied by deep peroneal nerve. Peroneus longus and peroneus brevis, they are present in the lateral compartment of leg, supplied by superficial peroneal nerve. The point is, you may mistake the peroneus tertius muscle for lateral compartment. Please remember, peroneus tertius muscle present in the anterior compartment of leg, not in the lateral compartment of leg. That is the point. You make a mistake. Okay. So don't do silly mistake. Peroneus tertius muscle, it is a muscle in the anterior compartment of leg. It is supplied by deep peroneal nerve. It is not in the lateral compartment of leg. It is not supplied by superficial peroneal nerve. Okay. So please read the word carefully. Peroneus tertius. Okay. Supplied by deep peroneal nerve in the anterior compartment of leg. Next one. Now, these tendons, they pass below the extensor retinaculum of the foot. Now, extensor retinaculum, we have 2 bands, superior retinaculum and inferior extensor retinaculum. Okay. Now, superior extensor retinaculum, which is very simple, starting from the anterior border of tibia, and which goes to anterior border of fibula. Anterior border of fibula. That is our extension of superior extensor retinaculum. Now, inferior extensor retinaculum, it is Y-shaped band. It is Y-shaped band. Now, the stem of the Y-shaped band attached to calcaneum bone and which bifurcate, and the upper band attached to medial malleolus, and the lower one which blends with plantar aponeurosis. So this is the band I'm talking about. The stem attached to the calcaneum bone and the upper one attached to medial malleolus and the lower one blends with plantar aponeurosis. So these are the 2 retinaculum bands, extensor retinaculum bands we have in the anterior compartment of leg. Okay. Now below this only, yes, the anterior compartment of muscles pass through. Now what are the neurovascular structures? Now we are seeing the neurovascular structures in this compartment. I told you already, the neurovascular structures are anterior tibial artery and deep peroneal nerve. Okay. Right. Now, in the lateral compartment of leg, we have peroneus longus muscle and peroneus. In the lateral compartment of leg, we have peroneus longus muscle and peroneus brevis muscle. Now, these two muscles helping for only one movement, therefore eversion. And they also maintains which arch? Lateral longitudinal arch. Okay. Lateral compartment of leg, it is supplied by which nerve? Peroneus longus and peroneus brevis. These two muscles in the lateral compartment of leg. In the lateral compartment of leg. Now, muscles in the lateral compartment of leg supplied by which nerve? Superficial peroneal nerve. Superficial peroneal nerve or superficial fibular nerve. Now, superficial peroneal nerve, superficial fibular nerve, after supplying these muscles, it becomes cutaneous. It supplies the entire dorsum. So, superficial peroneal nerve or superficial fibular nerve, it supplies the entire dorsum of the foot. Sensory supply to the entire dorsum of the foot. Sensory supply to the entire dorsum of the foot. Except we have the first web space. Now, the first web space supplied by deep peroneal nerve and lateralmost aspect of the foot. Lateralmost aspect of the foot. Lateralmost aspect of the foot, it is by sural nerve. Okay. Yes. And we know that the medial side of the leg is supplied by saphenous nerve. Medial side of the leg is supplied by saphenous nerve. Okay. Right. So, this is about the dorsum of the foot sensory supply. Now, see this diagram. Now, in this diagram, we are seeing the insertion of tibialis anterior, tibialis posterior, peroneus longus and peroneus brevis. See the diagram. Now, this is medial side and let us lateral side. Okay. Now, this one is tibialis anterior tendon, front side, tibialis anterior tendon. And this one is tibialis posterior tendon. Tibialis posterior tendon. Okay. Now, tibialis anterior tendon attaching to this bone. What bone? Your base of first metacarpal bone. Which side? The medial side of the base of first metacarpal bone and adjacent medial cuneiform. Adjacent medial cuneiform. The attachment of tibialis anterior attached to the medial side of the base of first metacarpal bone and adjacent medial cuneiform. Now, what about tibialis posterior? See, tibialis posterior mainly attaching to navicular bone and it is giving slips to all tarsal bones. After that, it is giving the slip of attachment. It is giving the slip to all tarsal bones except the talus bone. So, talus, it is the only tarsal bone which do not have any muscle attachment. Very important, talus bone. So, talus bone, it is the only tarsal bone which do not have any muscle attachment. So, tibialis posterior mainly attached to navicular bone and it is also giving the slip of attachment to all tarsal bones and also to 2, 3, 4 metatarsal bones. 2, 3, 4 metatarsal bones. That is insertion of tibialis posterior. Now, see this one, that is peroneus longus tendon. That is peroneus longus tendon. See, peroneus longus tendon present on the lateral side and then from lateral side, it goes to medial side. Okay. And attached to same bone of the attachment of tibialis anterior. So, peroneus longus attached to the base of first metatarsal bone and adjacent medial cuneiform bone. Adjacent medial cuneiform bone. The point is tibialis anterior attaching to medial surface of the base of first metatarsal bone. Here, the muscle attached to, tendon attached to the lateral side of the base of first metatarsal bone and adjacent medial cuneiform bone. Now, this one, peroneus longus attaching to the lateral surface of first metatarsal bone and adjacent medial cuneiform bone. So, tibialis anterior and peroneus longus attaching to same bone, first metatarsal bone and the medial cuneiform bone. Right. Now, can you see this one? That is peroneus brevis tendon. Peroneus brevis tendon attached to the base of fifth metatarsal bone. Attached to the base of fifth metatarsal bone. Okay. Right. So, these are the attachments of tibialis anterior and tibialis posterior. So, tibialis posterior attaching to, yes, all the tarsal bones except talus. Whereas tibialis anterior and peroneus longus attaching to the base of first metatarsal bone and the medial cuneiform bone. And peroneus brevis attached to the base of fifth metatarsal bone. Okay, right. So now we're going to discuss about one peculiar movement, inversion and eversion. See, inversion and eversion are the movements occurring at three joints. Number one, subtalar joint. Now, subtalar joint is also known as posterior talocalcaneal joint. So, inversion eversion movement occurring at subtalar joint. Subtalar joint. Subtalar joint is posterior talocalcaneal joint. Talocalcaneal joint. Okay, right. Number two, this inversion eversion movement also occurring at talocalcaneo-navicular joint. Second one. And inversion eversion movements also occurring at transverse talar joint. See, transverse talar joint means this one. Transverse talar joint means this is a joint between talus and the navicular, joint between calcaneum and cuboid. That is transverse talar joint. That is transverse talar joint. So transverse talar joint, so this is A and this is B. So A is talonavicular joint and B is calcaneo-cuboid joint. Okay. Now transverse talar joint. In these three joints, the inversion eversion movement will occur. Subtalar joint, talocalcaneo-navicular joint, and talonavicular and the calcaneo-cuboid joint. In these three joints, the inversion eversion movement will occur. Now, what is meant by inversion eversion, sir? Now, why we need this movement? See, inversion eversion movement, nothing but it's a medial turning and lateral turning of the sole. Inversion means medial turning of the sole. Eversion means lateral turning of the sole. Medial turning of the sole and the lateral turning of the sole. Now, why we need this movement, inversion eversion? To adapt when you walk on the uneven surface. So, when you walk on the uneven surface, without your knowledge, the sole turns medially and laterally. That movement is called inversion and eversion movement. Now, what are the muscles doing the inversion eversion? Now, inversion eversion done by, inversion is done by medial turning of the sole. Inversion is nothing but, it is the medial turning of the sole. What about eversion? Eversion is nothing but, it is the lateral turning of the sole. Lateral turning of the sole. Now, what are the muscles doing inversion? Inversion is done by muscles on the medial side. What are those? Tibialis anterior, tibialis posterior. These are the two main muscles on the medial side. They're helping for inversion. So, inversion is done by tibialis anterior and tibialis posterior. What about eversion? Eversion is done by peroneus longus and peroneus brevis. Tendons on the lateral side, they do eversion. That is done by peroneus longus and peroneus brevis. Okay? Right. So, there are muscles doing this movement. And we know this movement occurring at three joints. Posterior talocalcaneal joint, talocalcaneo-navicular, and transverse talar joint. Okay, next one. Now we're going to see some applied. Applied is the patient is having fracture of neck of fibula. The fracture of neck of fibula. So in the case of fracture of neck of fibula, the common peroneal nerve injury will be there. Common peroneal nerve injury. Okay, fracture of neck of fibula. So now, what are the muscles paralyzed? What are the movements lost in this condition? So fracture of neck of fibula, I told you common peroneal nerve, which wind around the neck of fibula, divided into deep peroneal nerve and superficial peroneal nerve. So in the case of fracture of neck of fibula, common peroneal nerve injury will be there, and these two nerves not work. Okay, what are the deformities? Now, in the case of fracture of neck of fibula, I told you the patient will have common peroneal nerve injury. Okay, what are the features? Number one, loss of dorsiflexion of the ankle joint. Loss of dorsiflexion of ankle joint. Why, sir? Because tibialis anterior, extensor digitorum longus, extensor hallucis longus, they are separated by deep peroneal nerve. So deep peroneal nerve injury, because of common peroneal nerve injury, yes. So loss of dorsiflexion of the ankle joint. So the ankle joint is held in plantar flexion like this. Okay, that is called foot drop. So patient have foot drop. Number one. Okay, sir. Number two, the complete loss of eversion. Loss of eversion. So eversion is done by peroneus longus and brevis, separated by superficial peroneal nerve. Here common peroneal nerve injury, so loss of eversion. Next, inversion is intact. Inversion is intact. Why, sir? You know the answer. Inversion is done by tibialis anterior and tibialis posterior. Here, tibialis anterior alone affected. Tibialis posterior is normal. Why tibialis posterior is normal? It is affected by tibial nerve. So one muscle is normal, that maintains the inversion. Okay, and then loss of extension of grade 2. Then loss of extension of lateral photos. Okay, loss of extension of lateral photos. Now these are the features of our common peroneal nerve injury. So these are the points that remember for common peroneal nerve injury. Okay, now these are the points were given in 2023 NEET exam, and 4 points were marked A, B, C, D like that, and based on the clinical features, the injury without the following marked site. That is a question we got. Now the point suggestive of common peroneal nerve injury winding around the neck of fibula. So the point towards the neck of fibula is C. That is a question we got in the recent NEET exam. Okay, now we're going to see the animation for the anterior and the posterior compartment of leg. Now see here, now we are seeing the posterior compartment muscle, gastrocnemius muscle. So we have two heads of gastrocnemius. Now we are also seeing one small muscle there, that is our plantaris muscle. Right. Now what is the action of gastrocnemius muscle? I told you the theory, it is crossing the knee behind, it is crossing the ankle behind. So this muscle, gastrocnemius muscle, also do the weak flexion of knee joint. The gastrocnemius muscle forming this tendon, Achilles tendon. Achilles tendon, it is crossing the ankle behind, it is doing the plantar flexion. The ankle joint is bending towards the plantar side. Right. So now we're going to remove the gastrocnemius muscle, and we're going to see, yes, one small vestigial muscle, that is our, yes, plantaris muscle. We remove that too. And now we are seeing the soleus muscle. So soleus muscle along with the two heads of the gastrocnemius forms triceps surae, and they form the Achilles tendon. See here, that is the Achilles tendon. So Achilles tendon is formed by the two heads of gastrocnemius and soleus. Now see the action of our, yes, soleus muscle along with the gastrocnemius, it is doing the plantar flexion. Okay, right. So now we removed the soleus muscle and we are seeing the deep muscles. We are seeing one septum. Yes, we are removing the septum so that you can see the deep muscles clearly. Now 3 muscles in the deep layer. Now the lateral one, this is our flexor hallucis longus, and the next one, tibialis posterior, and next one, that is our flexor digitorum longus. Now we also seeing one more muscle there, that is our popliteus muscle. Now the popliteus muscle, it is crossing the knee joint backside. This muscle initiate the flexion of knee joint. See the video? It is bending the knee, flexion of knee, popliteus muscle. Okay, right. Now we are seeing the, we're going to see the action of our tibialis posterior muscle. See, that is tibialis posterior muscle. Now tibialis posterior muscle, see the action. Tibialis posterior along with the tibialis anterior, it is doing one movement in the subtalar joint. Yes, what is that? Inversion. See the sole? The sole is turning towards the medial side. That is the inversion. So inversion is done by 2 muscles, tibialis anterior and tibialis posterior. Okay, right. Now these tendons, they pass below one band. Now see the band here, that band, yes, that is our flexor retinaculum band. Okay, now the tendons are passing below this band. The arrangement, I told you on mnemonic, Tom, Dumbledore and Harry. So first one, tibialis posterior, flexor digitorum longus, and this is the flexor hallucis longus. So mnemonic is Tom, Dumbledore and Harry. Right. Now this is a tendon arrangement below this flexor retinaculum band. Okay. Right. So now we are seeing the anterior compartment of leg. Now in the anterior compartment of leg, we have 4 muscles, tibialis anterior, and a small muscle is in between, that is the extensor hallucis longus, and that one is extensor digitorum longus. Now what is the action of tibialis anterior? Now, tibialis anterior and remaining two muscles, extensor hallucis longus, extensor digitorum longus, they bend the ankle joint in the front side. It is doing dorsiflexion. And I told you just now, the tibialis anterior and tibialis posterior turn the sole medially. That is the inversion. So now we remove the tibialis anterior muscle, and that is the extensor hallucis longus. We are removing that too. And this is the extensor digitorum longus. We are removing that too. Now we are seeing one small muscle there. I'll zoom it. That is the peroneus tertius muscle. Now, peroneus tertius muscle, it is present in the anterior compartment of leg, supplied by deep peroneal nerve. Action, it is helping for eversion. That is the point you have to know. Okay, peroneus tertius nerve supply, they will ask you. Nerve supply, deep peroneal nerve. Very good. Now, after seeing these muscles, now we're going to see two more muscles in the lateral compartment of leg. Lateral compartment of leg, we have only two muscles, peroneus longus, and just beneath that, we have peroneus brevis. So, peroneus longus and peroneus brevis, these two muscles are doing eversion. They turn the sole laterally. The sole is turned laterally like this. See, eversion muscles. Okay. Now, these are the actions of our peroneus longus and brevis. Now, next, we're going to see the nerve supply for these muscles. Each compartment, they have their own nerve supply. Okay. Now, this is the sciatic nerve. The sciatic nerve is divided into the tibial nerve and the common peroneal nerve. This is a common peroneal nerve and that is tibial nerve. Okay. Right. Now, tibial nerve, it is the nerve of posterior compartment of leg. See, all the posterior compartment muscles, your popliteus muscle, gastrocnemius muscle, soleus, the tibialis posterior, flexor hallucis longus, flexor digitorum longus, all these muscles are supplied by our tibial nerve only. And the tibial nerve also passing below this band. What band? Flexor retinaculum band. And then enters the sole. Okay? Right. Now, that is our common peroneal nerve. See here, common peroneal nerve, it is winding around the neck of fibula. And the common peroneal nerve, after winding around the neck of fibula, which in turn come to the front side and divided into two branches. Our deep peroneal nerve and superficial peroneal nerve. So, deep peroneal nerve, it is a nerve of the anterior compartment of leg. See here, that is our deep peroneal nerve. So, all the anterior compartment muscles are supplied by this nerve only, deep peroneal nerve only. Right. Now, we also going to see the one more branch, that is our superficial peroneal nerve. Can you see that? That is the superficial peroneal nerve. So, superficial peroneal nerve supplies two muscles, peroneus longus and peroneus brevis. Clear? These are the nerve supply for the various compartments of the leg. So, that's all about the leg. So, we know the leg, we know three compartments, we know the muscles, we know the actions, everything. Now, last topic in this module is the ankle joint. Now, who will form the ankle joint? Okay. Now, the ankle joint above is formed by it is formed by the tibia and its medial malleolus and fibula and lateral malleolus. So, above medial malleolus and lateral malleolus. MM means medial malleolus and L means lateral malleolus. Now, below we have talus bone. These are the bones involved in the ankle joint. So, tibia, fibula and below talus bone, ankle joint formation. Okay. Medial malleolar articular surface from tibia, lateral malleolar articular surface from fibula and below talus bone. These are the bones involved in the ankle joint. So, what type of joint is ankle joint? The ankle joint is the hinge joint. Very good. So, what movement occur? Flexion, extension movement will occur. Dorsiflexion, plantar flexion. That's all. So, flexion extension movement means the ankle joint, it is not having any ligaments in the front side and back side. Why? If ankle joint is having ligaments in the front side and back side, then they interfere with flexion extension movement. So, any joint which is doing the flexion extension movement, they have ligaments only on either side. They are called collateral ligaments, medial collateral ligament and the lateral collateral ligament. So, ankle joint is having lateral and medial collateral ligaments. Why? If they have ligaments in the front side and back side, they interfere with the movement, main movement, flexor extension. So they have lateral and medial collateral ligament, elbow joint, hinge joint, flexion extension movement will occur. They have ligaments on either side, medial and lateral collateral ligament. Knee joint, modified hinge joint. We don't have ligaments in the front side and back side of the knee, and we have ligaments on side, medial and lateral collateral ligament. Clear? Right. Now, what are the parts of medial and lateral collateral ligament? So we're going to write medial collateral ligament. So if I write the medial collateral ligaments, now we have some parts. Now all the parts of medial collateral ligament, they should start from medial bone, upper part. What is it? Tibia. They should start from medial malleolus. Is that clear? See, medial collateral ligament means ligament on the medial side. Now in the medial side, upper part, we have which bone? Tibia bone, medial malleolus. So if in the exams, if they ask about what are the parts of the medial collateral ligament, they have to look for only one word. If the ligament is having tibial in their name, then that should be the part of medial collateral ligament. So medial means tibia. But that's a very easy question, no? Definitely they won't ask all the following are the parts of medial collateral ligament except. No, you won't get the question like that. Now we have other name for the medial collateral ligament. That will be the question. The medial collateral ligament by attachments, which is giving the shape of deltoid. Okay. So medial collateral ligament is also known as deltoid ligament. It is giving the shape of deltoid. Okay. So what are the parts of deltoid ligament? So in this question, again, you have to look for only one word. What is that? Tibial. Tibial word should be there. Is that clear? So please look for the word tibial. Now they should start from tibia and they come to the lower bones. Talus bone, calcaneum bone and navicular bone. So what are the parts of deltoid ligament? So from the tibia to talus bone to the anterior part of talus, anterior tibiotalar. Now from the tibia bone to the navicular bone, tibionavicular. From the tibia bone to the calcaneum bone, sustentaculum tali of the calcaneum, tibiocalcaneal, and tibia to the posterior part of the talus bone, posterior tibiotalar. So these four are the parts of deltoid ligament: anterior tibiotalar, tibionavicular, tibiocalcaneal, and posterior tibiotalar. So these four are the parts of deltoid ligament. Clear? Any doubt? Right. Now, tibionavicular part of deltoid ligament, which blends with spring ligament. Okay. Tibiocalcaneal part of deltoid ligament attaching to sustentaculum tali of the calcaneum bone. Okay. Yes. These are the parts of deltoid ligament. That's all about the medial collateral ligament. Now, what are the parts of lateral collateral ligament? So again, lateral collateral ligament, first point, we don't have any other name for lateral collateral ligament. Okay. We don't have any other name for lateral collateral ligament. Okay. So lateral collateral ligament means they should start from the bones on the lateral side, upper part. Which bone? Fibula bone. They should start from fibula bone, lateral malleolus. Okay. They should start from lateral malleolus, fibula bone. From there, it come to talus bone, the front side, anterior talofibular. From the lateral malleolus, it comes to talus bone on the back side, posterior talofibular. Now from the fibula, it comes to calcaneum bone, calcaneofibular. So these three are the parts of lateral collateral ligament: anterior talofibular, posterior talofibular, and calcaneofibular. These three ligaments. Last point, that's all about this topic, ankle joint. Now, what is the most common ligament which is affected in the inversion sprain? The most common ligament which affected in the inversion sprain is anterior talofibular. That is the ligament which is most commonly affected in the inversion sprain. Okay, right. So that's all about the ankle joint. So the ankle joint, yes, we know the bones involved, and we know the ligaments, and we know the parts of the ligaments, And movements, very simple, no? The muscles crossing the front of the ankle joint do dorsiflexion. Muscles crossing the ankle joint on the back side do plantar flexion. Only plantar flexion, dorsiflexion. Two movements occur. Inversion, eversion movement, it is not a movement of ankle joint. It is a movement of subtalar joint, talocalcaneal navicular, and transverse talar joint. Okay? Yes. So that's all about this topic.